Our parents, mothers, fathers, uncles, and aunts are growing older, burdened by age. To keep them healthy, we do so much: good food, exercise, and, yes, lots of vitamins and supplements. But did you know that hidden dangers might lurk behind this goodness? For the elderly, the same vitamins that can save lives can also cause death if taken in excess. In this video, we'll learn which supplements are most dangerous to overconsume, why they cause harm, and how to protect health safely. Watch this entire video at least once to safeguard the lives of your loved ones. As we age, our body's cells functionality decreases, and digestion and absorption processes change. Therefore, many consider taking supplements to be safe. However, research suggests that excessive doses of vitamin A, D, E, B6, iron, or calcium can increase the risk of stroke, bone weakness, kidney problems, and even heart attacks in the elderly. In today's video, we will learn which vitamins are needed, when, and in what amounts, what harm can occur from overconsumption, and why you shouldn't take supplements without consulting a doctor. Caution can save lives. Let's learn the correct information. What is vitamin E? Vitamin E is a fat-soluble antioxidant that protects cell membranes and lipids from oxidative damage. It mainly comprises 8 types of compounds, of which alpha-tocopherol is the most active and essential form in the human body. Blood clotting process, coagulation. In brief, blood clotting requires platelets clotting factors such as thrombin, fibrinogen, vitamin K. In this entire process, blood changes from a liquid state to a clot, which is necessary to stop our bleeding. How does vitamin E thin the blood? We will now explore the 4 ways it affects blood thinning. Reduces platelet aggregation. Vitamin E prevents platelets from clumping together to form clots. Research has shown that alpha-tocopherol enters platelet membranes and reduces their functionality. Example, when platelet aggregation is reduced, blood does not clot easily, keeping it fluid. Protein kinase C, PKC. Inhibition. Vitamin E inhibits protein kinase C, PKC, a crucial enzyme involved in platelet activation. PKC inhibition means platelets become less active, reducing the likelihood of clot formation. Enhances the effect of prostacyclin. PGI-2. Prostacyclin is a substance that maintains normal blood flow within blood vessels and prevents platelet aggregation. Vitamin E enhances this effect. Works against vitamin K. Partially, vitamin K helps activate various clotting factors. If vitamin E is taken in excessive amounts, it can reduce the effectiveness of vitamin K-dependent clotting factors. Scientific evidence has shown that various studies, the American Journal of Clinical Nutrition, have shown that high doses of vitamin E increase the risk of bleeding, especially in those who take anticoagulant medications such as warfarin. Vitamin E supplementation increases the bleeding time or duration of bleeding. What precautions you should take? Although it thins the blood, excessive vitamin E intake can cause dangerous bleeding. It can interact with anticoagulant drugs such as warfarin, increasing the risk of bleeding. The key point I want to make: vitamin E thins the blood primarily by reducing platelet aggregation, inhibiting PKC, and partially suppressing vitamin K-dependent clotting factors. However, it should be taken in controlled doses, especially for those already taking blood-thinning medications. Why does excessive vitamin E intake increase the risk of hemorrhagic stroke? To understand this, we need to know what hemorrhagic stroke is, how vitamin E disrupts the blood clotting process, and how these 2 factors combine to create a dangerous situation. I will now discuss these topics in detail. If you haven't liked the video yet, please give it a like right now. What is hemorrhagic stroke? Hemorrhagic stroke occurs when a blood vessel in the brain ruptures and blood spreads within or around the brain. It can be of 2 types: intracerebral hemorrhage, bleeding inside the brain; subarachnoid hemorrhage, bleeding around the brain. Main causes of this stroke: high blood pressure, hypertension, blood thinning medications, reduced blood clotting ability, as occurs with excessive doses of vitamin E. How does excessive vitamin E increase the risk of hemorrhagic stroke? Let's learn about how platelet functionality is impaired. When vitamin E levels are high in the body, platelet aggregation decreases. As a result, the blood clotting process weakens. Studies have shown that high levels of alpha-tocopherol significantly increase bleeding time. The effectiveness of vitamin K-dependent clotting factors is reduced. Vitamin K is an important component of blood clotting. Excessive vitamin E intake works against vitamin K and reduces the functionality of clotting factors 2, 7, 9, and X. Reduced functionality of these clotting factors means bleeding will occur more easily. Interaction with anticoagulant drugs. If someone takes blood-thinning medications like warfarin or aspirin and also consumes excessive vitamin E, the effects of these medications are amplified. As a result, the risk of ruptured blood vessels in the brain increases many-fold. Scientific evidence in 2 studies revealed that Study 1, a study from the Harvard School of Public Health, 2005, showed that the risk of hemorrhagic stroke increases by approximately 22% among those who consume 400 IU or more of vitamin E daily. Study 2, the American Heart Association reports, vitamin E supplementation may slightly reduce ischemic stroke in the long term, but it increases the risk of hemorrhagic stroke, especially in those with high blood pressure or a history of anticoagulant use. Excessive vitamin E intake reduces blood clotting ability, reduces the effectiveness of vitamin K, impairs platelet function, reacts with blood pressure and medications. As a result, if a blood vessel in the brain ruptures, the natural process of stopping it is disrupted, and in this condition, hemorrhagic stroke can occur, which is life-threatening. Why are vitamin E supplements above 400 IU risky? Providing the answer based on science will make the matter clear. Vitamin E safe levels versus overconsumption. Safe level recommended upper limit according to the U.S. National Institutes of Health, NIH. The tolerable upper intake level of vitamin E for adults is 1,000 mg/day, approximately equivalent to 1,500 IU, natural form. However, regular intake above 400 IU for an extended period can cause dangerous side effects. Why is consumption above 400 IU dangerous? Increases bleeding risk. Vitamin E thins the blood. At excessive levels, for 100 IU or more, it disrupts the natural blood clotting process. Clinical evidence. Harvard research has shown that the risk of hemorrhagic stroke increases by 22% in those who consume vitamin E at levels of 400 IU or more. Increases risk of hemorrhagic stroke. Excessive vitamin E increases the risk of blood vessels in the brain rupturing because it works against vitamin K, weakening blood clotting factors. Science Journal reference. A study published in JAMA, Journal of the American Medical Association, in 2005 stated that vitamin E above 400 IU increases hemorrhagic stroke, although it slightly reduces ischemic stroke. Dangerous interaction with anticoagulant medications. If someone takes warfarin or aspirin and also takes excessive vitamin E, the blood-thinning effect of these medications becomes excessive, which can cause dangerous internal bleeding, disrupts the body's antioxidant balance. Although vitamin E is a powerful antioxidant, excessive consumption can also cause it to act as a pro-oxidant. This means that it can, in reverse, damage cells, and some studies have suggested it may increase the risk of heart disease and cancer. Prolonged consumption of vitamin E above 400 IU increases the risk of bleeding, can cause hemorrhagic stroke. In the brain, has mutual interaction with medications, disrupts the body's antioxidant balance. Therefore, exceeding this level without a doctor's advice is entirely inappropriate. What is vitamin A? Vitamin A is a fat-soluble vitamin. It comes in 2 forms: preformed vitamin A, retinol esters, from animal sources such as liver, fish oil, provitamin A, beta-carotene. From plant sources such as carrots, vitamin A is needed in the body for eye, skin, immune function, and nerve development. But excessive intake equals hypervitaminosis, and when the level of vitamin A in the body becomes excessively high, especially above 25,000 to 50,000 IU for a long time, it creates toxicity, especially in the nerves and brain. What is the cause of neurotoxicity? A. Astrocyte and glial cell dysfunction. Astrocytes are cells that surround neurons in the brain and maintain a stable environment for the neurons. Excessive vitamin A causes inflammation and apoptosis, cell death. In these cells, result nervous communication is disrupted. Headaches, seizures, and mental confusion occur. B. Calcium channel dysfunction. Excessive vitamin A disrupts the balance of calcium channels. This disrupts signal transmission in neurons. It creates neuroexcitation and excessive nervous excitement, neurotoxicity, increased intracranial pressure. ICPA, increased cerebrospinal fluid, CSF, production. Excessive vitamin A increases the production of CSF, brain fluid, and reduces drainage. This increases pressure inside the brain equals pseudotumor cerebri, idiopathic intracranial hypertension. B. Blood-brain barrier violation. Excessive vitamin A weakens the blood-brain barrier, BBB. This allows toxic substances to enter the brain and causes inflammatory edema. Pressure increases. Scientific research. We have noticed these too. New England Journal of Medicine, 1998. A woman was given 50,000 IU of retinol daily. After 6 months, she experienced headaches, pressure in the eyes, and visual disturbances, which was vitamin A-induced intracranial hypertension. British Medical Journal, BMJ, 1995. Arctic explorers who ate liver high in vitamin A suffered from terrible headaches, vomiting, and brain toxicity. Symptoms: toxicity symptoms, severe headache, blurred vision / double vision, vomiting, seizures, behavioral changes, pain behind the eyes, papilledema, feeling, pressure in the brain. Excessive vitamin A intake, especially in retinol form, damages nerve cells, disrupts nerve signal flow, increases CSF production, creating pressure on the brain, weakens the blood-brain barrier, causing inflammation. The result: neurotoxicity and intracranial hypertension, which can cause brain damage, blindness, and even death. 1. Vitamin A. What is it, and where does it come from? Vitamin A is obtained in 2 ways. Preformed vitamin A, retinol, retinol esters, found in animal sources such as fish oil, liver, eggs, milk. Provitamin A, beta-carotene, plant sources such as carrots, pumpkins, leafy vegetables. In the body, these are converted to retinol and then function. Vitamin A is fat-soluble. What does that mean? Vitamin A is a lipophilic molecule, meaning it mixes easily with fat/lipid but is not soluble in water. This means it requires fat for digestion and absorption. It is stored in the fatty parts of the body, such as adipose tissue, fat cells, and the liver. Absorption and storage process. Step 1. Absorption: vitamin A mixes with fat in food and forms intestinal micelles. Then, it enters the bloodstream along with fat particles called chylomicrons in the intestine. Step 2. Transport: chylomicrons carry vitamin A to the liver through the blood. Step 3. Storage: the liver stores vitamin A as retinol ester. Excess vitamin A is also stored in adipose tissue, fat tissue. This stored vitamin A is released slowly as needed, but excessive accumulation can cause toxicity. Science-based reason. Why does it accumulate in the body? Fat-soluble, so doesn't come out with water. Vitamin A is not soluble in water, so it cannot be excreted through urine, as vitamin C or B complex can. Therefore, the body stores it, mixes in the lipid layer. The hydrophobic structure, water-repelling, of vitamin A traps it within cell membranes and fats. Therefore, it does not break down easily but accumulates for a long time. Excessive vitamin A accumulation: hypervitaminosis. If someone consumes high levels of vitamin A, especially through supplements, for a long time, it can accumulate in the liver and fat cells in dangerous amounts, causing headache, vomiting, pressure behind the eyes, papilledema, bone loss, neurological problems, liver toxicity. Scientifically proven. Guyton and Hall Textbook of Medical Physiology. Fat-soluble vitamins, such as vitamin A, are stored in the liver and adipose tissue, unlike water-soluble vitamins, which are excreted quickly in urine. Journal of Nutrition. Chronic intake of preformed vitamin A in doses exceeding 10,000 IU/day can lead to hepatic accumulation and toxicity due to its fat-soluble nature. Vitamin A is fat-soluble. It is absorbed through fat and stored in the body's fat tissue and liver. Because it doesn't come out with water, it accumulates in the body for a long time. Excessive intake can cause toxicity and pressure on the brain, increased intracranial pressure, and stroke-like symptoms from excess vitamin A. What science says. What is intracranial pressure, ICP? Intracranial pressure, ICP, is the pressure inside the brain, which depends on brain tissue, blood, the amount of cerebrospinal fluid, CSF. When ICP increases, pressure is placed on the brain, blood flow is obstructed, and stroke-like symptoms, such as headache, vision problems, seizures occur. How does vitamin A increase ICP? Excessive vitamin A equals hypervitaminosis, and when a large amount of vitamin A, especially preformed retinol, is taken for a long time, greater than 25,000 IU/day. It accumulates in the body and creates toxicity, especially increasing pressure on the brain. Science-based reasons for vitamin A. Increased ICPA. Increased cerebrospinal fluid, CSF, production. Excessive vitamin A causes abnormal increases in the production of CSF, cerebrospinal fluid, inside the brain. Result: decreased CSF drainage, increased pressure inside the brain, ICP. This is called pseudotumor cerebri or idiopathic intracranial hypertension. B. Weakens the blood-brain barrier. Excessive vitamin A intake damages the blood-brain barrier, BBB, resulting in inflammation and edema, swelling in the nervous fluid. This further increases intracranial pressure. C. Distortion of astrocytes and glial cells. Astrocytes are cells that support nerves in the brain. Excessive vitamin A makes astrocytes inflamed and dysfunctional. As a result, swelling or edema around the nerves, disrupted transmission of neuronal signals, pressure and neurotoxicity in the brain. Stroke-like symptoms that may appear if ICP is excessive. The following symptoms appear, which are as serious as a stroke. Symptom explanation: severe headache, nerve excitation due to pressure on the brain, blurred/double vision, pressure on the optic nerve, vomiting, medulla oblongata is excited, seizure, overactivation of neurons, mental confusion, disrupted nerve communication. These symptoms look like stroke precursors, and if left untreated, can be severe. Scientifically proven. New England Journal of Medicine, 1998. A woman who was taking 50,000 IU of vitamin A supplements daily was diagnosed with pseudotumor cerebri, a problem of increased ICP. Symptoms: headache, double vision, vomiting. British Medical Journal, BMJ, 1995. Arctic explorers suffering from vitamin A toxicity experienced headaches, seizures, and eye problems. The main cause was increased pressure on the brain. Excessive vitamin A, especially in supplement form, increases the amount of cerebrospinal fluid in the brain, weakens the blood-brain barrier, causes inflammation in nerve cells, and as a result, the pressure on the brain increases, intracranial pressure. This can lead to stroke-like symptoms, even permanent nerve damage. Caution: taking greater than or equal to 25,000 IU/day of vitamin A is dangerous. Do not take retinol/retinol palmitate supplements without consulting a doctor. It is particularly risky for pregnant women. Why does excessive vitamin A intake cause headaches, visual disturbances, and coma? Let's find out what science says. What happens in the body when vitamin A is excessive? Vitamin A is a fat-soluble vitamin that is stored in fat in the liver in the body. Excessive intake causes a toxicity known as hypervitaminosis A, which has harmful effects on various organs of the body. Cause of headaches: increased intracranial pressure. Excessive vitamin A intake increases the amount of cerebrospinal fluid, CSF, inside the brain. This increases pressure on the brain, intracranial pressure. High pressure puts pressure on neurons, which causes severe headaches. Why do visual disturbances occur? Due to increased ICP, the optic nerve, the nerve of sight, behind the eyes, comes under pressure. This causes optic disc swelling or papilledema. This causes blurred vision, double vision, or eye pain. Why does the condition worsen to coma? If the pressure on the brain continues to increase and is not treated, blood flow may stop to various parts of the brain. This leads to nerve damage and loss of consciousness, which can lead to coma. Scientific evidence and examples. A report published in the New England Journal of Medicine showed that a woman who consumed 50,000 IU of vitamin A daily developed headaches, visual disturbances, and eventually a coma-like state, which was evidence of vitamin A-induced intracranial hypertension, pseudotumor cerebri. Excessive vitamin A intake increases pressure on the brain. Increased pressure on the brain can cause headaches, visual disturbances, and, if needed, a serious condition like coma. Therefore, it is essential to exercise caution when taking vitamin A supplements and to consult a doctor. Now we will learn about vitamin B6. What is vitamin B6 and what is its role? Vitamin B6, pyridoxine, is a water-soluble vitamin which protects nerve health helps in the production of neurotransmitters such as GABA, serotonin, regulates protein and amino acid metabolism. Why do neurological problems occur with excessive vitamin B6 intake? Toxicity mechanism: if B6 is taken for a long time or in very high doses, usually greater than 100 milligrams per day, the active form of vitamin B6, pyridoxal phosphate, PLP, can accumulate excessively in nerve cells, which negatively affects the myelin sheath of nerves and nerve function. How does nerve damage occur? A. Myelin sheath damage. B6 toxicity destroys the myelin sheath, protective covering around the nerves, which impedes nerve signal transmission, resulting in reduced nerve speed and sensation. B. Changes in nerve signals. Excessive accumulation of PLP disrupts neurotransmitter balance, which causes problems in nerve function. What is the role of vitamin D? Vitamin D is the main vitamin that increases calcium absorption in the body. It increases the absorption of calcium and phosphate from the intestine and maintains bone health. What happens due to excessive vitamin D intake? As a result of having excessive vitamin D, calcium absorption from the intestine increases greatly. The amount of calcium in the blood increases excessively, which is known as hypercalcemia. What is hypercalcemia? Hypercalcemia is when the level of calcium in the blood goes above normal. The normal blood calcium level is about 8.5 to 10.5 mg/dl. Causes of hypercalcemia with excessive vitamin D. A. More absorption. When vitamin D increases, the calcium transporter of the intestinal cells is activated, which rapidly increases calcium absorption. Excess calcium enters the blood. B. Renal calcium retention. Vitamin D increases the reabsorption of calcium in the tubules of the kidneys, so less calcium is excreted in the urine. For this reason, calcium accumulates in the blood. C. Calcium release from bones. Excessive vitamin D helps calcium to be released from bones into the blood, which increases blood calcium. Effects of hypercalcemia: fatigue, weakness, vomiting, abdominal pain, kidney stones, kidney damage, heart rhythm problems, confusion, weakness, even coma in the nervous system. Scientific evidence. A study in the New England Journal of Medicine, 2011, showed that excessive vitamin D supplementation increases the risk of hypercalcemia. According to the Journal of Clinical Endocrinology and Metabolism, excessive vitamin D intake can cause hypercalcemia and damage various organs in the body. Vitamin D increases calcium absorption in the body. Excessive vitamin D intake increases the level of calcium in the blood, which is called hypercalcemia. Hypercalcemia causes various physical problems and organ damage. Therefore, it is essential to follow the doctor's advice and the correct dosage when taking vitamin D supplements. The role of vitamin D and calcium. Vitamin D ensures the absorption and deposition of calcium in the bones in the body. But if there is excessive vitamin D, the amount of calcium in the blood becomes high.
Part 2 of this video is coming soon, so subscribe to the channel immediately and click the bell button to stay tuned to the NTG Healthcare 360 channel.